Are you struggling with back pain and assuming it is just aging or spine problems? What if I told you that sometimes this pain is not from your spine at all, but from your kidneys, quietly crying for help? In today's video, we are going to uncover 5 hidden kidney warning signs that often disguise themselves as simple back pain. Many people ignore these clues until it is too late, but if you know what to watch for, you can protect your health and even save your life. Before we dive in, please take a moment to like this video, subscribe to the channel, and hit the notification bell. These actions help us reach more seniors and families with life-saving health information. And remember, what you learned today may not only help you, but also someone you love. Let us begin with a surprising fact. According to experts at the Mayo Clinic, kidney disease often goes undetected until it reaches an advanced stage, because the early symptoms are so subtle and so easy to confuse with other conditions. Back pain is one of those confusing signs. You may think you pulled a muscle or strained your spine, but in some cases, your kidneys are the real source of trouble. That is why doctors urge older adults to pay close attention when back pain does not follow the usual pattern. The first red flag is back pain that comes with fever and chills. If you feel pain in your back and at the same time notice that your body temperature is higher than normal, this is not a typical spine problem. Ordinary back pain caused by poor posture, arthritis, or a herniated disc does not make you develop a fever. When fever and chills appear together with pain in the lower back, it often means that an infection is present. And very often that infection involves the kidneys. The Centers for Disease Control and Prevention reported in 2022 that untreated urinary tract infections can spread upward to the kidneys. When this happens, the infection causes severe pain in the back or side, combined with fever, shaking chills, nausea, and a general feeling of weakness. Unlike regular back pain from lifting something heavy or sitting too long, kidney infection pain tends to be deep, throbbing, and persistent. Patients often describe it as a pain that does not improve with rest and sometimes worsens as the infection grows stronger. Another detail to notice is the location of the looks very different from usual. These symptoms together tell the story. The body is fighting an infection, and the kidneys are in danger. Doctors warn that if this condition is ignored, the infection can spread to the bloodstream and cause sepsis, a life-threatening emergency. This is why recognizing the combination of back pain and fever is so critical. It is not something to wait on. If you or someone you know experiences this, the safest step is to see a doctor immediately. A simple urine test and blood test can confirm the diagnosis, and antibiotics can stop the infection before it does lasting harm. So, the first hidden kidney warning sign behind back pain is this: pain in your back accompanied by fever and chills. It is not normal. It is not just aging, and it must not be ignored. The next time you feel these symptoms, remember this message and take action quickly. Now, let us move on to the second hidden kidney warning sign behind back pain. This one is often overlooked because it feels embarrassing to talk about. It is back pain that comes together with changes in urination. If you notice that your lower back pain is joined by burning during urination, an urgent need to urinate, or urine that looks different in color or smell, you should not assume it is just a bladder issue. Very often the kidneys are involved. Doctors explain that the kidneys filter waste products and maintain fluid balance. When they are inflamed or infected, the urinary tract will usually show clear signals. According to a 2021 study published by the National Institute of Diabetes and Digestive and Kidney Diseases, many cases of kidney problems were first suspected because of changes in urine. People reported pain in the lower back, along with cloudy urine, dark urine, or even traces of blood. These warning signs are very different from ordinary muscle-related back pain. A strained back muscle will not make your urine burn or change color. Imagine this scenario. An older adult feels a dull ache in the back for several days. They take over-the-counter painkillers and try to ignore it. But soon they also notice that urination has become painful and more frequent, especially at night. This combination should set off alarms. Doctors at Harvard Health emphasize that when back pain and urinary symptoms appear together, it often points to a deeper infection or inflammation of the kidneys. Without treatment, such conditions can progress and lead to chronic kidney disease. Another subtle detail is swelling in the legs or ankles that comes with these urinary changes. When the kidneys are not filtering properly, extra fluid builds up in the body. So, if you are experiencing back pain, unusual urination, and swelling in the feet, this is not something to dismiss as normal aging. It is a sign that your kidneys are struggling and may need urgent medical care. Now, let us turn to the third hidden warning sign. This one is less obvious but equally important. Back pain that persists despite rest or common treatments. Most mechanical back pain improves when you rest, apply heat, or take anti-inflammatory medication. If your pain does not improve and instead lingers for weeks, it raises concern that the cause may not be
lack of appetite. This is very different from spinal pain that varies with posture or movement. The persistence of the pain is what makes it suspicious. A 2020 report in the Journal of the American Society of Nephrology explained that chronic kidney disease can produce vague back discomfort that remains constant for months. Patients often think it is just part of aging, until tests reveal reduced kidney function. By then, the damage is often advanced. This is why persistence is such an important clue. Doctors recommend that if back pain continues beyond 2 weeks without improvement, especially when combined with other symptoms like urinary changes or fatigue, you should seek medical evaluation. Simple blood tests and imaging can reveal whether the kidneys are the hidden cause. So, the second warning sign is back pain with unusual changes in urination. The third warning sign is back pain that refuses to go away, no matter what you do. Both of these should make you pause and consider that the kidneys, not the spine, might be the source. We have already talked about back pain with fever and chills, and about back pain linked to urinary changes or pain that refuses to go away. Now let us explore the last two hidden kidney warning signs that often disguise themselves as ordinary back pain. The fourth warning sign is back pain that comes with swelling in the body, especially in the legs, ankles, or around the eyes. This swelling, called edema, happens because the kidneys are not removing excess fluid and salt properly. Instead of keeping balance, the body begins to hold on to water, and gravity makes it collect in the lower limbs. You may notice that your shoes feel tighter than usual, or that socks leave deep marks around the ankles. Some people wake up with puffy eyes in the morning. When these symptoms appear together with persistent back pain, doctors take it as a strong clue that kidney function may be declining. The National Kidney Foundation explains that swelling is one of the earliest visible signs of kidney trouble. A 2019 review in the American Journal of Kidney Diseases reported that many patients first went to a doctor because of unexplained swelling in the legs, only to learn that their kidneys were under stress. The swelling itself is not caused by the spine. A disc problem or arthritis cannot make your feet puff up. So when swelling is part of the story, and back pain is also present, it strongly suggests that something beyond the spine is involved. The danger here is that people often ignore swelling, thinking it is just part of aging or due to standing too long. But when it is combined with lower back discomfort, it is not something to dismiss. Your body is telling you that the kidneys may not be filtering blood as they should. Left unchecked, this can progress to chronic kidney disease. The fifth warning sign is back pain that appears together with fatigue, nausea, or unexplained weight loss. These general symptoms are easy to overlook because they seem vague and not connected to the back. but doctors say they are often the silent signals of kidney failure. When kidneys lose their ability to filter waste, toxins build up in the bloodstream. This condition, called uremia, leads to tiredness, difficulty concentrating, poor appetite, and sometimes nausea or vomiting. A 2020 whole body. That is why these general symptoms matter so much. So let us recap all 5 warning signs. The first is back pain with fever and chills. The second is back pain combined with urinary changes. The third is back pain that refuses to go away despite rest or medication. The fourth is back pain with swelling in the body, especially in the legs and ankles. And the fifth is back pain with fatigue, nausea, or unexplained weight loss. Any one of these signs is serious on its own. But when 2 or more appear together, doctors say the chance of kidney involvement rises dramatically. These are not issues to postpone. Quick medical attention can mean the difference between a simple treatment and a lifelong illness. So, if you or someone you love is experiencing these kinds of back pain, please do not ignore them. Talk to your doctor, ask for simple urine and blood tests, and find out the true cause. Early detection saves kidneys, and in many cases it saves lives. Before we close, let me remind you, back pain is common, but not all back pain is the same. Do not assume it is always about your spine. Sometimes it is your kidneys sending a warning. Listening to your body and acting quickly is the best gift you can give yourself. Thank you for staying with us through this important discussion. If you found this video helpful, please like it, subscribe to our channel, and share it with others who may benefit. Your support helps us continue to bring you trusted, science-backed information for healthy aging. And remember, your health is your greatest wealth. Take care of it every day.